CT scan, which shows very good findings. So what we can see in this CT scan is we can very nicely make out that there is something present in this area. We can very crystal clear make sure that there is something apparently present in this portion of the brain. So what it is? It is not only present in one slide, in fact, it is present in several slides. It is present here as well, and it is present here as well. So the thing is, this is more of the patient presented with headache since around 10 to 12 days. The patient was known case of ITP, idiopathic thrombocytopenic purpura, and he was having a very low platelet count of around 8 to 10,000, and he was having the headache. That was the reason why the CT scan was done. So what we can crystal clear make sure is there is one hypodense uh, lesion or structure which can be very clearly made out in this area. The same thing is with here as well. There is hypodense lesion on this area. So the markings are not crystal clear. So it is more of a concavo-convex structure. Means this is more of a, like this. So uh, this is definitely a bleed because the patient platelet count was very lesser, and this is in short present outside the brain, and it is shifting the brain toward the opposite side. So when we can very nicely make out here that this is the line where the lesion is there, and this is the brain, and this is the brain. So this brain is significantly reduced in size because this blood collection is compressing or pushing the brain to the opposite side, that is towards the right side. So in short, this is the midline, but this midline appears to be shifted to this side because the blood is here and this is compressing the brain toward this side. That is the reason why the sulci gyri on the left side, they are not evident, and we can very well notice the sulci on the right side, but on the left side we are not able to make sure the sulci. So here the sulci are very much prominent, crystal clear, but on the left side it is not. So we can see the blurriness here because that is all pushed to the right side. The other things which we can see is this lateral ventricle. See, this lateral ventricle is very clear, but on the left side it is totally compressed. The same thing here. The lateral ventricle is completely compressed compared to the right side. It means the left side of the brain is simply compressed or pressed by the bleed. This is subdural hematoma. You can see this lateral ventricle is very crystal clear, but it appears compressed and shifted toward the right side. See the midline. Midline has to be uh, here in the center, basically. But because of the mass effect, the brain is shifted to the right side. And this is very clear. Now, whenever it comes to bleeding, we always look whether it is subdural hemorrhage or whether it is extradural hemorrhage. Now, whenever we see subdural versus extradural usually has a convex border like this. It has convex border, whereas whenever it comes to STH, it has concavo-convex border like this. So in our case, this is more of a same structure. So this is a subdural hemorrhage and not extradural hemorrhage. So there are so many beautiful findings in this CT scan. The same thing here, and this is the CT scan images of the same patient. So we can very nicely make out the changes, the subdural hemorrhage, which is here, the shifting of the brain parenchyma towards the right side, the compression of lateral ventricles, the disappearance of this sulci gyri because of the presence of this blood on the left side. So this is all about today's uh, CT scan. We'll be meeting up again in the next topic. Thank you.